All right, thank you, everyone. We will call this Legislative Audit Commission Evaluation Subcommittee meeting to order. Today is October 6th, 2025. The time is 10:02 a.m., and we are in room G23 of the state capitol. I believe that the protocol is to take roll. Is that correct? Yes. Clerk will take the roll.
Senator Dibble.
Here.
Senator Drazkowski.
Present.
Senator Rest.
Present.
Representative Anderson.
Present.
Representative Lee.
Present.
And Representative Quam.
Present.
Everyone's present. We have a quorum.
Thank you so much. So a quorum is present. And members are tasked today, being the evaluation subcommittee, is to select some additional potential topics for the Office of the Legislative Auditor to prepare background papers on. And then in a few weeks, we will winnow all of the potential program evaluations down to a smaller set to recommend to the full Legislative Audit Commission. So, Senator Rest.
On that, Mr. Chairman, I don't recall how many more topics we were going to, whether we informally or formally agreed to do in the fall. Now, do you recall?
Ms. Munson Rodriguez can help us
Okay.
remember more precisely. I had those questions myself, and she answered them, and so she's got a whole presentation she's going to give us on kind of where we're at. And
Thank you. Thank you. I appreciate that very much.
So with that, why don't we just toss the ball to Ms. Munson Rodriguez to help us understand our task a little bit better today.
Thank you, Mr. Chair. For the record, my name is Jody Munson Rodriguez, and I'm the Deputy Legislative Auditor for OLA's Program Evaluation Division. And if it's all right with the Commission, I'd like to just walk through some of the information here and remind us kind of where we're at in this new process. Typically, OLA has received just one round of evaluation topics from this Commission per year. It happened in the spring. As you'll recall, this spring, the Commission voted to start giving us topics in 2 different times during the year. So this is our fall selection period. Back in the spring, the Legislative Audit Commission Subcommittee, this evaluation subcommittee, narrowed down this giant list that you have in front of you to 11 potential topics. OLA prepared background information on those, and then this subcommittee ultimately selected 7 of those 11 evaluation topics for recommendation to the full committee. And so OLA has been moving forward with those 7. What you will see on this large list now is that the 4 among those 11 that were not selected are highlighted in teal. There is also a 5th one that is highlighted in teal. That is because one of the selected topics was both assisted living facility and nursing home licensing. As we noted in that background paper, it was a very large topic. We ended up having to split it. And so we are moving forward currently with the assisted living facility licensing evaluation, and we've prepared a background paper for a separate nursing home one. So you see that those 5 are already in consideration. I guess we can say we have background papers prepared on them. And what we're asking you to do today is select an additional 5 topics, those topics that are not in teal on this large list. We will prepare background information on those as well, and we'll bring you all 10 topics probably within 5 weeks or so for consideration, and then ask you to select 4 ultimately to provide to the full Legislative Audit Commission as a recommendation to move forward with. Our plan would be to move forward with those 4 topics probably in early spring once we've finished our current slate. And I'm happy to answer questions.
Great. Thank you, Ms. Munson Rodriguez. Questions at this point, members? Senator Rest.
I don't understand what the teal color is. I don't see teal. I see purple and yellow and blue, but I don't see teal.
So,
So members, that's a great question. The teal that Ms. Munson Rodriguez was referring to is the list that you
on the
find in the
list.
first three
Okay.
pages of the packet. So
Okay.
if members have that in front
I
of
see,
them.
I see.
The members
I see.
members online, do you have that document in front of you electronically or hard copy? you know
Mr.
what-
Chair, if I may.
Ms. Munson
I do,
Rodriguez.
Mr. Chair.
Thank you, Mr. Chair. If you're looking at the large list on that first page, number 37, State Oversight of Long-Term Care Insurance.
Okay,
And
I
then on
see.
the second page, you'll see number 53, 61, 62, and then
And
91.
All right.
you.
Did I hear Senator Drazkowski?
You did, Mr. Chair. I've got the list.
Okay, great. All right. Unless I hear differently, I'll assume everyone knows what's in front of us.
Appreciate
Great.
it.
All right, so, members, the five in front of us are ones that we've nominated previously, and then, for the reasons that Ms. Munson Rodriguez articulated, those have been postponed to this process, this kind of mid-year process that we initiated this past year. And so I'm not going to make this in the form of a motion quite yet, but I would suggest that we put those on the list of those items that we'll be considering in a month or slightly longer than a month from now. And then I think then the process that we have to engage in is to nominate 5 more today. Does that make sense?
In addition to these 5.
In addition to these 5, if that makes sense and if that's agreeable to members. Silence or nodding would indicate that. Okay, great. Okay, with that, Ms. Munson Rodriguez, should we just open it up for nominations or conversation?
Thank you, Mr. Chair. Yes, absolutely. If you have questions on any of these, I'm happy to go through them. I
Great.
can highlight some, however I can be helpful.
Great. Okay, so members, why don't we do this? Why don't we open it up for whatever you would like to discuss, or if you have questions of Ms. Munson Rodriguez on any of the items about their potential as good program evaluations. Representative Quam.
Thank you, Mr. Chair. And looking through it, I see number 30, Office of Emergency Medical Services. I understand that is the replacement for EMSRB. Am I correctly? Okay, I see a nod of confirmation.
right.
Now, one of the things that also does seem to impact is some of the non-emergency medical transport, at least when I was on there, because we needed to coordinate some services. So there are 11, 30, and 84 have to do with either non-emergency medical transport or the emergency medical services. The new organization, is it too new to review for an audit?
See, Mr. Kirshner is coming forward.
Mr. Chair,
Ms.
if I
Munson
may, I'm
Rodriguez.
going to have one of our program evaluation managers come up to help with this answer. He completed the 2022 evaluation of the Emergency
Well, while
Medical
he's doing
Services
that,
Board.
Representative, thank you, Mr. Chairman. Representative Quam, were you asking that question with regard to number 11 or number 30?
Representative Quam.
It's number 30, but I see this general area being very important to greater Minnesota because of the volunteer ambulance services and those activities, plus people with disabilities have difficult transportation access.
I understand that, Mr. Chairman, Representative Quan. I was just asking, is the non-emergency medical transportation a well-established program, and the EMS, the OEMS, is a more recent program? That's all I was asking. Not the value of either one of them.
Representative Quam.
Thank you, Mr. Chair. I think sort of yes to both. My thought is that we need to have something in this area, and when they do the generation, the write-up about how they would analyze and research it, then we can maybe get into refining it.
I see.
Thank you, Mr. Chair.
Welcome. Please introduce
Thank you,
yourself.
Mr. Chair. For the record, my name is David Kirshner. I am a manager in the Program Evaluation Division, and not only was I the manager for our work on Emergency Medical Services Regulatory Board a few years ago, but I also, quite a few years back, participated in our evaluation of non-emergency medical transportation, so I'm familiar with both of these topics. I will say that they are two rather different topics, although as Representative Quam says, they are both, I think, very important topics for us to be thinking about as a state. Emergency medical services is when somebody has an emergency and you call an ambulance, and that can be anybody. Anybody who has an emergency can call an ambulance and get paramedic treatment or EMT treatment and so forth to be transported to the hospital. Non-emergency medical transportation is specifically for people who are receiving public assistance in terms of medical care. And it is not especially useful to be able to have your medical appointments paid for if you have no way of getting to them. And so non-emergency medical transportation is a public benefit that is provided to people who are receiving medical assistance in order to be able to get to their appointments. And I will say very quickly, I'm speaking off the top of my head from memory, and so if I get anything slightly wrong there, that I will apologize. But that's the rough distinction between the two programs. They are both, I think, very important to look at and for us to be thinking about them as a state, but I do think that from the point of view of our office, they would be two rather different evaluations for us to look at and not something that would be combined together.
Question?
Senator Rist.
Thank you. So is, from what I gathered from what you said, the emergency program, which is topic 30, when 911 is dialed, that call is answered without any consideration whatsoever of immigration status. Is that correct?
Mr. Kirshner.
As far as I am aware, I don't, that is not something that our evaluation looked at, but that is, as far as I know, that's not something that is asked by anybody.
And with regard to number 11, Mr. Chairman, immigration status would be asked and would not be available to those who don't have, who are not officially green card, whatever, asylum status. If they are undocumented, completely undocumented, they may not use that service.
Mr. Kirshner.
Thank you, Mr. Chair. It would be only available to people who are receiving other types of public medical benefits. So to the extent that immigration status is a part of other types of medical benefits, it would be the same for non-emergency medical transportation. So it's.
They didn't have it, Mr. Chairman. Sir, if they didn't have it under some other program, they can't get it under this either. Is that correct?
It is tied together with other types of medical assistance or public benefits in which people get medical care.
But with regard to Mr. Chairman, sir, with regard to topic number 30, if you're in a automobile accident and the ambulance comes, they don't say, are you documented and where's your green card?
Mr. Kirshner.
Thank you, Mr. Chair. I can't speak to every circumstance under the sun, but as far as I know, that is not ordinarily what is done.
Senator Rist.
Thank you.
I think part of the question, Mr. Kirshner, of Representative Quam's, and let me know if I get it right or not, is under item 30. I believe, if I'm not mistaken, we made some changes to the structure and governance of emergency medical services recently. The question was, is it perhaps too soon to look at whether it's functioning optimally or not? that correct?
And-
All right.
Mr. Chairman?
Oh, Senator Russ.
If you look at the brief description, and I joined Representative Quam in thinking both of these are very important, particularly right now in our relations with the federal government. But the topic number 30, the emergency ones, was just done as a program evaluation in 2022. So the question about whether it's too soon to have additional information that would be helpful seems to me to kind of slide that down to something else, or maybe it would be more appropriate next year. But with regard to topic 11, we haven't looked at the non-emergency one since 2011. So that might push it up a bit more to be considered important for 2025, 2026. It's like almost 15 years ago.
All right. Representative Quam.
Thank you, Mr. Chair. The reason I grouped these together is that general area has a lot of discussion in greater Minnesota. And the three are in that general topic. The one, yes, is probably too soon to redo. That's why I asked, which would leave the other two. 84 with the fraud with the non-emergency. I believe around a dozen years ago, maybe a little bit longer, there was an entity that had a great deal of characterization, and there was concern about it. In fact, they were prevented from handling some stuff by the state, but several counties were using them. So that why, if we're, the other two then would be, relational, look at what's happening with that in general, and you could look and see if there are some suspicious type activities. We don't have a lot of extra money, and I want, anytime there's fraud, that means that people that should be getting services probably aren't. So, that's what I was thinking, is if they write up that topic, and then if we need to fine tune it, that'd be great. By just thinking that's a high profile thing. Thank you, Mr. Chair.
Thank you. Senator Russ.
So, Mr. Chairman, Representative Quam, are you more concerned about fraud perpetrated by providers or by the individuals asking for the service?
Representative Quam.
Thank you, Mr. Chair. I am generally looking at the providers because, frankly, as from the previous discussion, these are people that already are qualified in a program. So therefore, that background has been worked on. It's just when you have a shortage of access, there's a tendency possibly to not look as closely at all of the, you're just happy somebody is, fitting into that space. And that's why I thought these two might be one of the five.
All right. All right, Ms. Munson-Rodriguez.
Thank you, Mr. Chair. I rarely say this, but I do think that those are two that we could put together. Compliance is generally something that we look at in most of our evaluations. And so if you'd like to move forward kind of a combined topic of 11 and 84, I think that that is something we could put together for you.
You read my mind. All right, so we'll put that,
It's part of an initial
yeah,
proposal at this
yes.
point.
All right,
That
I'll
would
take
be
a,
one that would be in a motion, Mr. Chairman, don't you think, maybe?
yeah, yeah. If we, well, I don't know if we intend to come back to a combined proposed list or take them as one-offs, but I'll leave that to the committee to determine for themselves how they want to proceed. Further questions or nomination of topics, members? I will ask a question about a particular matter, and that has to do with the waiver reimagine.
Can we come back to?
Oh,
so
Madam Senator Rest, yeah.
Thank you. So just to be clear, were we thinking of 11, 30, and 84?
Senator Rest, I think just 11 and 84.
Just 11 and 84?
Yeah, the non-emergency medical transportation.
Okay, not leaving 30 out because it's so recent.
It's recent and it's different from non-emergency transportation.
Got it. Okay.
So my question for whomever wants to venture an answer is, we hear a lot, oh, thank you. Before I go to my questions, I'm not noticing hands up. I don't even see them, so I'm going to rely on you to help me. Tell me who's got their hands up, because I literally don't see them on my computer here. So we will go to Senator Drazkowski and then Representative Lee. Senator Drazkowski.
Thank you, Mr. Chair. I'm wondering, Mr. Chair, if Ms. Munson Rodriguez could review for us where we're at. I'm trying to remember the discussion about how we could handle the Medicaid programs. There's several of them on here. There's number 73, the DHS oversight of Minnesota Care. And there is another one. I know I was asking about those last time, and there was a plan for achieving some of that. And I'm wondering if Ms. Munson Rodriguez could remind us what that is.
Ms. Munson Rodriguez.
Thank you, Mr. Chair. Thank you for the question. For number 73, the primary question has to do with eligibility of Minnesotans enrolling in Minnesota Care. That is something that our financial audit division has done in the past. And we can certainly have that on our list for consideration for a financial audit in the future.
Okay.
Since it's a very kind of narrowly scoped question, it's a little bit more suited to that division.
Thank you. Senator Drazkowski.
Thank you, Mr. Chair. Thanks, Ms. Munson Rodriguez. What do we know about the CCAP program? And I know we've got the 2019 audits. I'm wondering if she could expound on where that's at. I don't know that we have solved the problems, the massive problems in that program legislatively.
So,
I wonder if she could comment.
so Senator Drazkowski, you're looking at item number 63.
I lost the number here, Mr. Chair. Yes.
All right. All right. I
Thank you,
see-
Mr. Chair. I'm calling all my friends today.
All right. We have phone a friend. We have Auditor Randall. Welcome.
Thank you, Mr. Chair, members. For the record, Judy Randall, Legislative Auditor. Nice to see you all today. Excuse me. The previous one that Senator Drazkowski mentioned is in fact on our list for a financial audit starting in January. That's related to eligibility for medical assistance. Related to the Child Care Assistance Program, that is also something that we could look at through our financial audit division. And again, it's more of a compliance and control type of look, which we like to use our financial audit division for and save our program evaluation staff for broader evaluations. You could include it on this list here, and it's something that, of course, the program evaluation division could do. But it's also something that the financial audit division could do, and if not there, we could look to work on it in our special review unit.
Senator Drazkowski. I'm going to go to Senator Rest, who's raised her hand, if that's okay.
Just quickly, Mr. Chair, if I could, would Ms. Randall come? So we were looking at the CCAP program, and we heard from them on that. We also heard about number 73, the DHA oversight of Minnesota Care. What about number 80, medical assistance fraud prevention? What are the plans with that one? Did we have plans or not? That was a question.
Thank you. If that's all right, Senator Rest, we'll go to,
Sure, of course.
all right, Auditor Randall.
Excuse me. Thank you, Mr. Chair. Senator Drazkowski, thank you for pointing me to that one as well. That would also be a financial audit division audit that would be best suited for that, because again, we'd be looking broadly at controls. To be honest, I think we would probably do either 80 or, and I've lost track of, or 73. And probably not both in the same year. We do like to try to look across state government. And so I'm happy to have conversations with you offline regarding 80 versus 73. And then 63, the CCAP one, I do think if we don't look at that through financial audit, we could do something through our special review unit on that.
And Auditor Randall, financial audits and special reviews don't necessarily need to be nominated by the LAC for action. Is that correct?
Thank you, Mr. Chair. Yeah, that's a great question. So the law requires the Legislative Audit Commission to select the program evaluation topics. The Audit Commission clearly directs the work of the Program Evaluation Division. The financial audits that we conduct each year are performance audits. Those are the control compliance ones. Those are selected by leadership in OLA based on risk factors, things that we have seen that are concerning, time of year. So we try to regularly audit the constitutional offices, for example. And then the special reviews are selected also by a leadership team along with the whole allegations team. And those are based on credible allegations that we receive, whistleblower complaints, and legislative requests.
Great, thank you. Senator Rest.
Thank you. So with regard to 63, there was the, let's see, the oversight, or whatever we want to call it, the review in 2019 was a special review and not a financial audit. When is the last time that the Child Care Assistance Program was subject to a financial audit? That would be important to me to know in terms of moving forward with that and in terms of obviously internal controls and compliance.
Thank you, Mr. Chair and Senator Rest. 2019 was the last time that we took a look at CCAP. We did both a special review and a financial audit. So
okay.
the look at internal controls was done through the financial audit division.
Okay.
Great, thank you. Senator Drazkowski, were you finished?
I am. Thank you, Mr. Chair.
All right, great. Representative Lee.
Thank you, Mr. Chair. So I just have two questions. I think the first one is more about process. The second one will be about a specific topic. And so for the deputy auditor, are we required for this selection to meet those different criteria of looking at something that was done before, something that's a board commission or whatnot, or can we pick from five different areas and not have to go by the policies that we adopted last year?
Thank you, Representative Lee. I think we've fulfilled all of our minimum selections out of the various buckets. And so I think we're just free to do as we see fit today, but I will look to, we'll just kind of make it up. But Ms. Munson-Rodriguez, can you help us understand if we have any constraints today or not?
Thank you, Mr. Chair. Thank you, Representative Lee. Yes, per the policy that the commission adopted about a year ago, the Legislative Audit Commission is only required to direct us to do one follow-up evaluation and one border committee per year. We already have two of each on our docket, and so that requirement has been fulfilled. You certainly can select additional topics from those lists, but you are not required to.
Great, thank you. Representative Lee.
Thank you, Mr. Chair. And then now specifically to just a topic, the stadium, U.S. Bank Stadium. I know that's, I think, a special review that was done previously with a lot of the interest from a lot of the professional sports teams coming to the legislature to ask for potential funding. I believe that Hennepin County Target Field was a creation of the state. Do we know, are the other stadiums, professional stadiums, creation of the states? And can we take a look at those stadiums too, or is it only eligible for US Bank because of the Sports Facilities Authority?
Representative Lee, are you looking at a particular item that's on this list? And if so, does it have a number?
Mr. Chair, it's line 32, US Bank Stadium Finances.
32. Thanks. Sorry if I missed that. All right. Ms. Munson Rodriguez, are you able to respond to the question?
Thank you, Mr. Chair. That would be up to the evaluation subcommittee. We had determined previously that we were going to select from this list, but if the subcommittee determines that they would like to add an additional topic so that we would look at a stadium other than US Bank, we certainly could. I'll leave that up to the chair and the members.
Representative, excuse me, I think Senator Rest has a clarifying question or an observation.
Well, I think the 32 is certainly one that we should consider. I don't think that we need to, I think it gets very, very confusing because the authorities and the owners of the professional sports stadium, and also including the finances that drive the Bank Stadium at the University of Minnesota, that would be a very, very huge undertaking. And it seems to me that if we go with this, which I don't have any particular objection to, that we limit it to the one that's brought up here to give us a clear understanding. And of course, in 2017, we discovered through that special review a number of irregularities, which I think we would find in all of the other major sports interviews. The irregularities that were discovered in the 2017 OLA report don't exist in the other financing, and were corrected. If there were any, they were corrected shortly thereafter, so that there was no conflicts of interest, there was no special consideration for legislators, and et cetera, et cetera, et cetera. But looking at US Bank itself, I think that might be a very interesting topic, quite frankly, if others don't rise. I think it's more of a curiosity, however, than information that we couldn't find out just from the reports made by, and their audited reports made by the Sports Facility Authority. They're not an unaudited entity, which would be the only hesitancy I would have, that we would be getting duplicative information.
Thank you. Representative Lee.
Thank you, Mr. Chair. Maybe on that point, to the OLA, then, would it be, to what extent would it be more work for your staff if we were to consider more than just one of the stadiums that we have in the state of Minnesota to take a look at their finances, or is it doable for us to look at all of them? And I think it's going back to why I'm interested in this, is just because many of them are, coming of age and are coming back to the state legislature to look at using public dollars to upkeep the stadiums and whatnot. And so we're really understanding the need of why we are asking taxpayers to put in more dollars for these. I think that's something that we should consider. Thank you, Mr. Chair.
Thank you. Auditor Randall.
Thank you, Mr. Chair, and thank you, Representative Lee, for the question. I think it's a great set of questions that you've asked regarding managing the ongoing maintenance of these large facilities. I will, however, echo what Senator Rest said, which is the U.S. Bank Stadium itself, the financing behind it, and the hundreds of pages of contract in that agreement would be more than a full-time project for OLA, just focusing on U.S. Bank Stadium. However, I'm sure we're happy to meet with you to talk about maybe crafting a new proposed topic for the next round related to ongoing maintenance and focusing really on the maintenance aspects of these different facilities we have across the state.
Representative Lee.
That's all for now. Thank you, Mr. Chair.
Thank you. All right, Representative Quam.
Thank you, Mr. Chair. And all of us have seen issues with, I guess, fraud in, federal and state cases. And a lot of them have to do, with what 40-some% of our budget is in healthcare. Looking at item number 70, it'd be nice to understand if their processes of the Inspector General could be looked at to improve, because my thought with all of the whistleblowing and tips and stuff coming, that the Inspector General would be able to more quickly, because they're integrated into the, DHS, to be able to find and prevent. So I would consider 70 being a very timely topic, especially the consideration of, do we need to have an independent Inspector General entity? So maybe some clarification on that topic. Thank you.
Thank you. Did you want a response, sir? All right, Senator Rest.
Well, I would agree with that, except there's been so much, and maybe even more discussion in the House than in the Senate, of actually revising or reforming the OIG statute. And I wonder if that topic gets to be more salient when we're actually reviewing new legislation, if we can ever get it passed. It's one of those things that you just brought up for the other one about the difference between timeliness and if you don't know what's there, what can you evaluate if we're going to change the law, which I think a lot of people are legislators, bipartisan, Democrats, Republicans alike, are very interested in doing. So I wonder how you respond to that, Representative Quam.
Representative Quam.
Thank you, Mr. Chair and Madam Chair. I would have thought that the bill would have gone. There seems to be some controversy about how to develop it. If we look at our existing inspector generals and how they're doing their job and effort, and then have an independent look at how we could improve that, then the legislature will have documentation to help do the best improvements. Right now, I think there's a lot of what if going on in the discussions. I'd like to have the auditor give us some information so we could make a more informed and better decision. And it appears as if we would still be having these other inspector generals, from what I've heard of some of the arguments. So what we do is try and get information so the legislature can do a better job of improving our bureaucracy and systems. And I think having an audit, covering that number 70 might be useful in the long-range improvement of it. And so who knows when something might be scheduled for committee. Thank you, Mr. Chair.
And,
Senator
Mr. Chairman, I'm just concerned about, about this topic coming up now, that the report might not be to us before we actually change the law with regard to the Inspector General for DHS. And I wonder if the program evaluation should be based on whatever new law we hopefully would pass next year. And I think one of the questions has been, and that I would like really clarified, is what are the different responsibilities and authorities, and which ones are in conflict between claims for an OIG and the duties and responsibilities and statutory obligations of the Office of the Legislative Auditor. I would not like to see that we end up with an investigation of something that puts the OLA and an OIG at odds with one another about who has the authority to move forward and who reports to whom. You know, if the OIG discovers something, is the OIG required to inform the legislative auditor? And the answer to that question is yes. And so how does the legislative auditor investigate itself? If they are the, I mean, it's just a circle of who tells what, who has authority over what, and maybe the topic, not that the topic should be avoided, but that it should be better refined once we have real clarity in new legislation and a new law about who's responsible for what, particularly because the OLA office is a legislative body, and the OIG, you can say it's independent, but independent of what? It's still going to be an executive agency's, you can't make it outside of it, as far as I know. Maybe somebody can come up with that, but at some point, either someone in the executive body, the governor's office, we know who does for the OLA, it's the LAC. And we have recently, we have the authority to, and have done performance reviews of Auditor Randall's office and herself personally, and we are the hiring agency, not the political leaders in the legislature, but the members of the Audit Commission, which is, as you know, totally bipartisan and bicameral. So I just wonder how much of a sticky wicket it would be right now to get to that, since we're going to have, since there's great interest in oversight and potential fraud, and how we prevent that, or what steps can the legislature take, and even further, how much are we accountable for programs that we put in place that we do not ask for? We think they're all feel good and we want to do good, and we do not put into the legislation significant accountability to hold the state agencies responsible to. So those are just some questions that I've had, and I've had with authors of the OIG bills of how do you make the distinction between the responsibilities of the OLA and potentially ones of a revised OIG system.
All right, I'll let Senator Quam respond, and I see hands up from Representatives Anderson and Senator Drazkowski. Assuming they're wanting to jump into this conversation, I'll get to you after Representative Quam.
Thank you, Mr. Chair. And my main reason for bringing this up is I understand the delay of implementation of something like this. And the sooner we actually have some background information that may be assistive that this would give, the better we'd be able to move forward. Snail pace is what I am detecting,
Maybe so.
especially with the very close, tie and et cetera, and the chambers. And maybe this would uncover a golden nugget of, hey,
Maybe so.
let's improve this. So I'll sit back and I'll listen to the other members. Thank you.
Representative Anderson.
Thank you. I have, I guess, a couple of questions for the legislative auditor. And first of all, I think I know what the problem is, serving on the fraud committee and being the author in the House of the OIG bill. And I think that there's a very, very good chance that this bill will pass the House next year. And my goal, obviously, is to pass the independent OIG bill. So I guess my question is, do we have enough time to actually do something, through the OLA office before we are back here in February, hopefully passing the OIG bill? I mean, is there even time? Because I don't want to delay this, because for you to do a study on what we already know the problems.
Who would like to respond? All right, Ms. Rodriguez.
Thank you, Mr. Chair. Thank you for the question, Representative Anderson. Currently, all of our staff are engaged in other evaluation activities. If you direct us to move a team onto this project, we certainly would. In order to get you any information by, I'm assuming, deadlines, we would probably have to select one question among these various ones to present you with information. So I guess what I'm saying is it would be limited and potentially not as broad as you're hoping for.
Auditor Randall.
Thank you, Mr. Chair, and thank you, Representative Anderson, for the question. I wanted to just point out maybe a couple things that might be helpful for the conversation. Topic number 70 is focused on the Department of Human Services Office of Inspector General, which is a standalone office within DHS, and something like that is required by federal funds to exist within DHS. So whether or not a statewide OIG is created, there will be some version. It may be exactly the same, or who knows what the bill will do. It may revise it some way, but the state agency that is responsible for overseeing medical assistance is required by federal law to have a program integrity oversight process, which Minnesota does through its DHS OIG. So that's some context that I think is helpful. So then I think the question for the commission or for the subcommittee is, so number 70 is about looking at how DHS OIG operates. Again, that function will continue to exist within DHS, regardless of what happens with the statewide OIG discussion that is ongoing. Now, as Representative Quam suggested, we could learn some useful things in our look at DHS OIG that could perhaps be applied to a statewide OIG, but based on the information Deputy Legislative Auditor Munson Rodriguez, that's really long, said, we likely wouldn't have that information to you all as you are, in time for the discussion and contemplation of the statewide OIG. So just, there's some nuance here that's important in terms of what you're asking us to do and how it would or wouldn't affect the work you're planning on for next session.
Great. I see Senator Rest's hand up, but I'll go back to Representative Anderson. Or do you have to
Just
clarify?
to clarify.
Great, Senator Rest.
Mr. Chairman, Representative Anderson, as I recall from reading, and of course I'm not on the committees that have considered it, but there is already in the legislation a carve-out for the very purpose of medical assistance, the federal requirement. So that's a section, if it's not an article, there's a section in the legislation that specifically addresses the OIG federal requirement. Representative Anderson, is that not correct?
That's correct, Senator Rest.
Thank you.
All right, Representative Anderson, going back to you.
Well, I won't, belabor this, but they are two separate things, but the OIG bill, like the legislative auditor said, is a all-encompassing, statewide independent. It doesn't change the fact that there will remain an OIG within several of the agencies, not just DHS, but that's the biggest one, obviously. So I just want to point out that most of the things that have been are being prosecuted now, actually, it's the feds that have come in and exposed, or frankly, TV news stations. So we know there's a problem. We've known that for a long time, that there's a problem with the state, with the individual agency OIGs. But I don't know that doing an audit showing that, or doing a program evaluation showing that, which would mean we'd have to throw everything else out, between now and February or March, will change what we're going to do anyway with the statewide OIG. So that's my 2 cents.
Thank you. Senator Drazkowski.
I think one of the things I reflect on here, we have a unique position from the legislative branch to be able to look in upon the operations of government within the executive branch with the OLA and its existence and its operations. If we look at the massive fraud that has been happening in the state of Minnesota, the bulk of it, and the huge bulk of it is coming from the area of human services. We have a human services IG that's been in place for a number of years. I haven't seen a single report out of them, members, not one, that has identified fraud. It's coming from federal investigations, other police investigations, and the people within the agency itself that are right next to what is going on are not identifying fraud. Now, I've heard from people, from whistleblowers and others, that they haven't even attempted at times to fill positions within this office. There has been other foot dragging going on. A lot of us are very suspicious about what's going on in the executive branch and what's not going on in the executive branch to address fraud. Again, we are in a very unique position here as we represent the people of Minnesota in the legislative branch to have the tool to go in and find out what in the world is going on that the sheer people that we appoint to prevent fraud have not brought forward an iota of fraud from their cubicle next door when we have the federal government coming in and identifying all this fraud. Members, this should be a flashing red light to us. As has been pointed out, the IG bills, the IG bill that passed the Senate does keep the DHS IG intact, and if it passes, likely will still be there going forward. So I don't see the problems that members have raised.
Thank you. Mrs. Munson Rodriguez.
Thank you, Mr. Chair. And I would just note that at this time, we only have one topic selected, and we will only be producing background papers on them. And so this sounds like a topic with a lot of interest. We would be happy to put together additional information for consideration if that would be helpful in the discussion. Then we can give you some information on each of those criteria that the commission has selected to use for evaluating topics.
So excellent point, just to kind of ground our conversation or bring us back to our task today, which is, thank you, is to, we have 5 topics that I assume we're going to ask for, or we're going to revisit the background papers on in a few weeks' time, and we're looking at asking for up to, remember, we don't have to ask for a fully 10 topics to consider, because ultimately we're going to recommend to the Audit Commission 4 additional topics for program evaluations. So we can look at up to 5 more topics which the auditor's office is going to write background papers on that we'll read in the meantime and then nominate for total in a month. So that's all a long-winded way of saying all we're doing today is asking for more background on the subjects. So before I call on you, I do have Representative Anderson.
I just have a change the topic to another one.
Okay, very good.
But go ahead.
All right, so Representative Anderson.
Quick. I agree with what Senator Drazkowski said, that we should, it's good, it would be great to get a background paper and more information on this. What I don't want to do is mix the 2 issues, because no matter what happens with the statewide OIG issue, that doesn't change the independent agency IG issues, problems, I would say. And so we should look at that too as a separate thing. But I don't want us sitting waiting for that to hold up the statewide OIG bill.
Very good.
That makes sense.
Yes,
So,
makes
thank
total
you.
sense. Appreciate that. Thanks. All right, Senator Rest.
Thank you, and I agree completely with what with what Representative Anderson, her last comment. We don't want competing things. We want them in an orderly fashion, and this, this is October. And the one I would suggest us to consider is number 23, and that has to do with the LCCMR. Both the auditor and I and Representative Quam, I believe, have gotten inquiries about whether whether this body, the LCCMR, is acting correctly in accordance with the constitutional requirements for the funding that comes to the LCCMR for their projects. And even within this one, there is there's some difficulty because the LCCMR is indeed a legislative commission, but it does have citizen members. And the only issue is not, it would seem to me, or not the only issue, but the issue is not the authority of the LCCMR to disperse the funds, but only if they are being dispersed in accordance with the constitutional requirements. And on that point, then I think there is legitimacy in looking at that topic, since it has been raised as an issue of controversy by not a legislator, but by a member of the public.
All right, thank you. All right, any response? Okay, very good. I think Senator or Representative Quam had a suggestion he wanted to raise.
Thank you, Mr. Chair. And because of the recent deaths in regards to MnDOT construction and activities, number
90.
number 90. We could see if that could give us some insight on how the safety standards are, maybe there's some safety training and et cetera. But, yeah, I just think that is timely because of the recent tragedies. Thank you, Mr. Chair.
Senator Rist.
I agree, but we have one chosen going forward here now, 91, and that would be choosing two out of the same department. I don't have any objection to doing that, by the way, but Senator, I would really appreciate, Mr. Chairman, your opinion on that, about doing both the Transportation Accountability Act, which is already on our list of 5, and then adding this another one there. What do you think, if you don't mind saying?
Before I say, I do have a question for the auditor. What is the gist behind item 90? Does it have to do with work sites along the sides of roads, and is it trying to get at some of the issues that Representative Quam was talking about? I think we've had 3 fatalities in the last few weeks of workers, both, well, I think they've all been contracted workers, but in any case, they are workers working alongside the road on road projects. Is this the kind of work site we're talking about? Ms. Rodriguez.
Thank you, Mr. Chair. This topic has actually been on the list since the prior topic selection period. So we've been hearing concerns about safety within these types of sites for some time now. So I wouldn't say that they're directly related to the most recent events, but certainly those could be a consideration if we moved forward with the topic. And with regard to having 2 transportation topics, again, these will only be for consideration. We wouldn't necessarily need to move forward with both of them. If they were both selected, we could also talk about kind of staggering.
Great, thank you. So to respond to your question, Senator Rest, I'd be comfortable with both. I feel strongly about the TTAA. We've been trying to get underneath the issues that have been brought to our attention for a few years now, and very much want to see that one selected, just to play one of my cards before before the time is up in a few weeks. I will strongly be backing the selection of item 91 at the time. But we have done taken some steps in implementing some pilot study of camera enforcement and the like in work zones. And so some of that information will be, some of that data will be percolating up. And so it's kind of and we've been struggling with this issue of work site safety for a while. We have to get control of it. It's just terrible what's happening out there to our workers along the sides of the roads. So I'd even be comfortable with both of them going forward if we deem that to be advisable in a month's time or so. Representative Quam.
Thank you, Mr. Chair. And I'm shifting to the last one I've had that I'm going to talk about. I've had a lot of teachers. I used to be on a school board, and a lot of teachers are reaching retirement, and there's a lot of concern about the, 43 is a teacher retirement, the TRA type thing, and I don't know if we've had a recent audit on that, but the volume of phone calls seem to indicate it's important to quite a few people. Thank you.
All right. Although I will say we just took a major step on TRA in this last session, so I think a lot of teachers are feeling more comfortable with the stability of the funds and the potential retirement benefits. So take that under advisement. All right. Thank you. Appreciate that suggestion. All right. I have a question for the auditor. I started the question, and that's on waiver reimagine. And the reason it caught my eye is because we hear a lot about it. And what we hear is the direct opposite of thing. You know, we hear this and then we hear this. And we hear a lot of anxiety from our constituents about what it means in terms of their ability to continue to enjoy waivered services, home-based services, have a substantial role in you know, developing a plan that's suitable for themselves. And then we hear everything's fine, it's a really smart way to proceed, it's a reform that's necessary, it's going to do a lot of good and make everyone's lives better. And so, you know, that's why we have you here. Like, what's true? People just tell us stuff. We don't know what's going on. I actually, not being on the Health and Human Services or Human Services committees, have even kind of lost track of how far along we are in the whole waiver reimagine process and what has changed, or if it's still kind of in the planning stages or not. So do you have a sense of this whole topic area and whether or not it's ripe for some illumination that your office is able to provide or not?
Thank you, Mr. Chair, for the question.
Oh, I'm sorry, I should mention the topic number. I don't remember which one it is. Do we
It's
know which?
89, I believe,
Number
Mr.
89.
Chair.
Thank you, 89 members. All right, thank you. Sorry about that. Thanks.
Sure, thank you, Mr. Chair. I think those are all good questions. Honestly, I'll say I share in your, I'll say uncertainty or lack of clarity in terms of where are we in the process. I too have heard concerns. I have also heard it hasn't been fully implemented yet, or it's still in process, and that it's been in process for a long time. I don't know what the facts are at this point. And honestly, that might be a perfect topic for a background paper then, because a background paper could at least help establish where we are in the timeline of implementation. If we're still in the middle of implementation, then it's probably not a good time to do a program evaluation. If it just was implemented, it probably also isn't a good time for a program evaluation. But if parts have been implemented, we could look at that. If it hasn't been implemented and it's taking an unnecessarily long time, we could look at that. So I mostly have questions at this point, but I think those questions have been percolating for a while with folks. So at least a background paper would give you some more information, and then we could make a decision.
Great, thank you. Senator Rest.
I'm ready to make a motion based on some of the things that we have
All right.
discussed.
Great.
And that would be 11 and 84, 23, the one I just suggested, 90 and 89.
So 11 and 84 would be combined, so that'd be one.
Yeah.
Right. 23, which is the LCCMR. 90 is road safety. And then waiver.
89. And I think
Oh.
a couple of
I'm
those are
sorry.
really big topics, too.
Okay, and 89, okay. So that's four. That would leave us the ability to add a fifth background paper. I heard a strong sense that the OIG one might be a good one. That might be why Senator Drazkowski has his hand raised. Senator Drazkowski.
Which number is that, if you don't mind?
Thank you, Mr. Chair. I would add to Senator Rest's list number 70.
Yes, okay.
70.
All right, so nominated, if you accept that as a friendly amendment,
Yes, I
that's the
do.
OIG one.
Yes, I do.
All right, so nominated to add to the five already, we have our 11 and 84, that's non-emergency medical transportation, is combined into one. Item 70, that's the Human Services OIG matter. Number 23, that's LCCMR. 90, which is road safety. And 89, waiver reimagine. Anything further, members?
That's my motion.
All right. All right. Do we need to take a roll call?
Only if there's an objection.
Oh, okay. All right, Representative Quam.
Mr. Chair, I'd move for acclamation for accepting the list.
All right, all in favor, say aye.
Aye.
Aye. Opposed, say no. All right, motion carries. Thank you, members. Ms. Munson Rodriguez, any further business for us?
Thank you, Mr. Chair. Just to remind you all, then, we will be reaching out to schedule a follow-up meeting where we will present the background papers for you to review, make a selection to recommend to the full Audit Commission that I would anticipate will be in about 5 to 6 weeks.
Great, thank you. Anything further, members? With that, we're adjourned. Thank you.